So the number to remember is 1.3. So if the number is less than 1.3, then the likelihood of that patient having severe fibrosis or scarring in the liver is extremely low. And that is a general statement in a primary care setting where the prevalence of a lot of scarring is low. And so just like when you interpret any test, you need to understand, what the performance characteristics are of that test. And so the FIB4 is unfortunately not as accurate in excluding disease when you apply it to a high risk population. So for example, if you have somebody with multiple cardiometabolic risk factors, particularly diabetes, where the liver enzymes tend to be lower, then a low FIB4 should be, I think it's still valuable, but it needs to be repeated in the future. And then ideally, if possible, a secondary test should be performed in people who have very high metabolic burden. And I would say people with diabetes, those are really the target population to do secondary testing in, depending on what's available to the provider.
Okay. And so the frequency of testing, if there's a normal test, that would be part of the annual blood work that's done for the patient.